This is No Spin Live, and do we have a show for you today? We're going to talk about the Zoom effect and a Dallas woman arrested for illegal buttock injections. And we've got some incredible international plastic surgeons to clear up the air on all of these hot topics. So we got Dr. Chet Mays from Louisville, Kentucky. Chet, how are you?
Doing great, doing great. How are you guys doing?
Excellent. And then last but not least, Dr. Jason Pozner from Boca Raton, Florida. And you can see it's still sunny there.
Florida. It's beautiful here. Look, this is my beach office.
It's like, look at that. The water always looks so nice, Jason.
I think this is where we do the buttock injections, on the water like this, at the beach, with the stuff from Home Depot.
Get some
You're from Boca Raton, not Miami, so we know that's not true. But hey, you know, it's a good, that's just another deal from Zoom, and that's what we're talking about, the Zoom effect. This article that we just highlighted is about how plastic surgery has really exploded because allegedly people are looking at themselves on Zoom and going, oh my God, like I need to do something. So Chet, I mean, what do you think? You put any validity into that story?
Oh, for sure, for sure. You know, I think there's a lot of effects going on right now. Just we didn't know what was going to happen when we sort of came out of the shutdown from COVID, and you know, things sort of picked up. Usually in the summer, we're taking time off, time away, just because people aren't really wanting to have the body procedures and wanting to enjoy outside the facial procedure. But the uptick in facial procedures with that, people talking about their conference calls. I'm working from home. I'm seeing my ears in the mask, and you know, I'm doing a lot more otoplasty than I normally would be doing. And, you know, facial injectables is up just because people are covering up what we're doing under a mask. They don't really care about bruising, but, you know, they're seeing poor lighting. Patients come in like, how do I look better in this lighting? I'm giving them like tips and tricks on how to get a flash right in front of them when they're on these meetings. But it is definitely an uptick here in Louisville, Kentucky with cosmetic procedures. Now that's going all over the world, actually. I'm sure down in Miami and Texas. You guys seeing the same thing there with that?
Jason, you sent the story. What do you think?
We've been busy. I mean, no, it's. I think no one has any place to go. Who's going anywhere during COVID? You know, what are you doing? You're sitting home. You're wearing your mask. You know, so I have these people. They have bangs and this. The only thing you see is eyelids. So we're doing a ton of eyelids. You know, and what are you gonna do? You're on a Zoom call and you did your eyelids, and you'd be like, okay, sorry, my video's not working. All right, back to video now. You know, so it's easy to hide surgery now. So we've been slam busy with stuff. You know, so actually with everything, it's been a very busy number of months since we're allowed back in. So
Jason, do you think it's any different than, you know, we used to say like, oh, when the social media thing comes out, people are taking selfies and then, oh, the plastic surgery business is up. I mean, is it really people looking at Zoom, or, I mean, I find it a little bit odd that, I mean, you don't think if people look at themselves in the mirror and they brush their teeth, maybe they're on Zoom more than they brush their teeth, which is a problem in itself.
Right, true. But do you remember a couple of years ago when I said to you, I couldn't even look at myself here we're doing these no spins and my eyelids look terrible. So I had my eyelids done because I hated the way I looked on these calls. I think the people are going through the same thing. You see yourself and you're like, okay, my neck's pretty good because I do a lot of Peloton, but maybe my eyelids need doing. But also it has to do with, we talked about this last time, how you position your camera. So if you're positioning your camera low like this, your neck looks terrible. So you have to position the camera right to make yourself look better on Zoom. But it's easy to come to us and get some work done.
How am I looking on Zoom? Am I looking okay?
Oh, you're always perfect. You're always perfect, Chet.
And hopefully, I don't know how long this tape's going to last on my neck.
I'm just jealous of the hair. I would get another 2 inches if I had hair like him.
But you cut it all off, man, right?
I cut it all off.
You cut it. It's like you get high and tight. It's high and tight in Florida.
It's high and tight. That's why when I have to come for filming there, they spend 2 hours on my makeup to get rid of the reflections.
So in terms, Jason, are you doing more? Do you see uptick in surgical or non-surgical?
You know, pretty much both. But I think surgery's been really, really busy over the last few months. What's a little bit strange is often in September, we're a lot of facelifts, a lot of facial stuff. And I found a lot of body contouring this month. I mean, I can't tell you how many breast revisions with Galaflex I've done this month, or reductions with fat grafting, or take out the implants and fat grafts. Normally it's a lot of faces in September, and I'm finding myself doing a lot of body stuff in September, and a lot of eyelids. I did one this morning at early. Guy. Yeah. And this guy, he wrote a book. He gave me his book, and he said to me, I'm going to be filming a lot for my book. I don't like my lower lids. So, and he had really bad fat, like huge. So I did a lower lids this morning.
Yeah, we have seasons here in Kentucky, so surgery follows the season. Summer, you're not doing a lot of body because people are enjoying the lakes, the rivers, the outdoor activities. But this year, with people being at home, work, not traveling, that we saw uptick in procedures that we typically wouldn't do in a certain season. So that's been the big. I don't really know if it's Zoom effect or if it's people just have that extra money to spend on themselves because they're not traveling right now. They're not spending that, and that's what patients tell us. They're like, I got this money. I'm not going to Europe. I'm not to the country, spending it on myself, and that's more of what I'm seeing here in Louisville. It's just there's no season for a certain procedure right now. It's everything up.
Yeah, that's I think that seems to be the trend, even worldwide. You talk to some international colleagues, and they're seeing the same thing. Yeah. Well, let's move on to
Bill. The guys in New York, though, I talked to in New York City, are they're saying they're like 25% of normal volume in the city. On the island and suburbs, they're doing pretty well, but New York City docs are suffering. They say it's like a ghost town there.
Is that because of their governor? No, I don't want to get into that.
I think so. I think it's bad politics.
All right, so let's move on to the next story. All right, Jason and Chet, I'm just gonna read the headline and then you guys count the red flags and we'll get into it. But Dallas woman faces murder charge after police say she gave illegal butt injections that killed a Fort Worth woman. The suspect, who goes by the nickname of Jag Booty, faces a murder charge in the death of the victim. And it goes on to say that this actually happened in May. The person was just arrested, but Jag Booty, who was 55 years old, met the victim in a Home Depot parking lot. And I think even the Krispy Kreme donut was the waiting room. But then she went back to her house, had silicone injected into her buttock, and 6 days later died in the hospital. And the post-mortem showed she died from silicone embolism to the lungs. So this is actually the second of this that's happened in Dallas, but it's happened all around the world. Jason, you sent the story. What's the message to the viewers?
The message is really, do I really need to even explain this? I mean, you got to be kidding me. So let's kind of dissect this story a little bit. First of all, usually these stories are in Miami, person died from silicone injections. That's usually the hot spot of this, not like Dallas, Texas. Number two, in our little pre-call, I think the biggest question here is, did she get the silicone at Home Depot? That's what we want to know. Was this medical silicone? I mean, the only medical silicone I know comes in these little tiny vials, and it's approved for intraocular use for retinal problems, okay? So I don't know any medical silicone that's approved for use at this point for larger volumes and eyelid stuff or eyeball stuff, okay? Third part is, met them in a Home Depot parking lot. It's not like a mobile office. You have a big van there that says like Jag silicone butt injections. I mean, you got to be really kidding me. Like no flags went up in this lady's eyes. But, it just shows you that when it's too good to be true, potential problems can arise. I mean, come on. Like what they say, come on, man.
Yeah, I mean, Chet, it's crazy.
Yeah, I mean,
people would do something like this.
Yeah, I mean, your headline, the red flags, I mean, I think I counted like 8 of them. My standards might be lower than some. You might have 10 or 12, but it's a tragic story. It's like you guys said, it's not just happening in Dallas, but I'm glad you guys brought this to light because it just sort of gives you that idea of people are wanting discounted procedures and they're willing to put their health at risk to get a little idea of some augmentation or some little youthfulness. And as board certified plastic surgeons, we don't see those. We're seeing patients who are trying to educate, and getting stories out like this, the name Jag Booty, we can laugh about it, but getting these stories out is educational for people because they realize there are extremes out there and we're trying to prevent this. Someone lost life because of this situation of putting in a substance that went to the lungs and killed them. And the red flags were there. I don't know the whole story before why they chose this person, but I just want to think that this is not the norm, that's not what all you guys are doing in Dallas. I assume you didn't train the Jag Booty there with you, Bill. Hopefully that's not the case, but it's just the...
Yeah, but you're exactly right, Chet. It's like, this is an extreme kind of end of the spectrum story, but the point is probably broader. I mean, like, it's like you get on a plane and, you know, Donald Duck or the ostrich is going to fly the plane. You're going to go like, wait a second, something's not right here. You would think that
You got to break.
meeting your doctor in the Home Depot parking lot, you know, is probably not the best place to do a consultation. But this thing gets more subtle, right? You know, I guess that's my question for both of y'all. What advice do you have for patients? Because what we do see there's a lot of people that do cosmetic surgery, and a lot of them perhaps don't have the training that certainly the two of you have, being the experts you are, but even there's people that just go to a weekend course and they're doing things that we know, and that can be less subtle because they have medical offices and they have degrees on the wall. So what's the message to patients how to decipher through this?
Well, if you want me to start with this, is that one thing is, we know that we've had a lot of calls on this no spin about buttock injections. That's a dangerous area, even fraught with complication in the best of hands. So with that, we have to be super careful around the butt. There's big veins, and when you inject fat or other substances, you can have a death like in this unfortunate case. So even in the best of hands, you can have these kind of problems. So with that case, to me, when you're dealing with something extremely dangerous like buttock injections, you need to go to the highest denominator, not the lowest denominator, jag booty. So start with that. And then again, you have to be careful. It's informed consent. I mean, this is a tough area. But you're right. It could also happen with a Restylane injection or an unapproved injection into an intravascular area on the face, even in the best of hands. So to me, it's like I see some of the people where I usually, my denominator factor is, would I let this person cut my dog's toenails? And the answer for most of the physicians is no. I wouldn't let them near my dog's toenail. So I'm certainly not going to let them near my significant other's face with a needle other than me or someone I trust, like Bill or Chet.
Chet, what advice you got?
Well, I mean, I saw this advice on a towing truck one time. It's you can't fix stupid, but we can fix what stupid does. That was their sort of slogan. You know, people.
Good.
That's sort of where we're at with this. Like, this person who made this decision unfortunately lost their life 6 days later, but there's a lot of factors on that individual who made that decision to go to jag booty. It's just a tragedy, and you know, we got to educate. And if you have friends or loved ones like, I got this good deal on this, like, you got to really delve deep in the credentials of whatever, you know, like Bill said, cosmetic surgeons, they're going under this facade that, we do all cosmetic procedures. Well, they might have done that weekend course, or they might have, you know, been a family practitioner who did a little extra injectable, and now it's just scary. And as plastic surgeons who we put in the time and effort and get the certification and the maintenance and training, like, we just do things at the highest level, and we expect that from everyone. And unfortunately, that's not what's going on in the rest of the world. And we got to come together as a group and set ourselves apart and stick together as plastic surgeons, because this stuff is on all over the place.
So when someone's trying to sell you a gold Rolex for $100, it's probably not the best thing you should be spending your money on, right?
Right.
Yeah.
For sure.
Yeah, and actually, Jason, that's what I was going to say. There's we can talk about, there's a lot of nuances, and certainly you talk about board certification by the American Board of Plastic Surgery, but most patients have a hard time even figuring out how to say that, let alone figure that out. But then you can look for the emblems of our societies, which guarantee that doctor has gone through the proper route and is board certified by the American Board of Plastic Surgery. But at the end of the day, like you're saying, Jason, it always comes down to money. And that's all these stories have a common denominator. It's always somebody offering something for a cut rate, basically. And I think that's probably something that needs to be a red flag for patients. You know, it's not to say that maybe there's a good deal out there from a really well-qualified surgeon, but you got to do your homework. You got to figure it out.
I mean, how many times have you seen a surgical patient in your practice for some surgical revision done by someone decent, but the problem is they tried to do too much. They did breast, they did tummy, they did lipo, and then something's messed up because that surgeon was rushing, where you know, is if they took their time and maybe split it into two cases, they probably would have had two excellent results. You know, most of my surgery practice is revisionary surgery, and I see this all the time. Sometimes it's just stuff gone wrong, sometimes it's just aging stuff, but a lot of times it's just stupid stuff. You know, they just pushed the envelope too much. Didn't need to do that.
Yeah, crazy. Hopefully we won't see too many more of these stories, but unfortunately I think we will. But the message, be safe, do your homework. So I think that's some great stuff, guys. So for Dr. Jason Pozner, Dr. Chet Mays, and Dr. Bill Adams, you can see more of this on the plasticsurgerychannel.com.